Okay, good afternoon and welcome to another episode, I should say exciting episode of the Real Talk Show. And of course, a show brought to you by 𝗙𝗏𝗲𝗃. And today we're discussing something really, really interesting, something that is not so different from what we usually talk about. But this one's going to be different because we have one important guest who is here to just help us navigate through what we are going to talk about and just to get clear understanding of what exactly we're talking about. And not forgetting to introduce the topic of the discussion today. We are talking about the difference between an STI and a UTI. How do you differentiate these things? Do they confuse you? Or maybe do you get to have some questions or you mix them up at some point? Well, today's show is going to just help us to ensure that we all understand what exactly this all is all about. So before I go so much further, I hope you have all seen what exactly is happening on the screen, as we have a different face today, a face that is going to help us just talk about what we're about to discuss today. And before I mess it up, before I mispronounce some names here, I'm going to allow my guest to just introduce himself, where he's coming from, his name, and his position, so that we can know who exactly we're speaking to today. Mr. Jones, you can go ahead.
Good afternoon, viewers. Thank you for having me to be part of this program this afternoon. My name is Dr. Jones Neba, your clinician. I'm a clinical officer as well. I'm the current president of the Clinical Officer Association of Zambia, and I'm delighted to be part of this program and to share some of the very important information about our topic, which excites me as we begin our show. Thank you.
Thank you so much for that, Doc. I'm going to call you Doc. Thank you so much for that. And as you all know, we have that one person we don't get to hear from, but then they get to help us to just ensure that this show is inclusive to each and every particular person who's watching or maybe listening. And for this show, we have Memory Zulu. Memory is the one helping us to just do the science and ensure that our friends out there are able to participate and just engage in this conversation. So as mentioned earlier, today we are looking at stay informed, stay protected, understanding the difference between an STI and a UTI. So Doc is here to just help us understand as young people, because most of the times we get to mix the two. Like we don't really get to understand it, especially looking at the fact that we don't understand the symptoms. That's why it's very important for this show, for you to listen to this show or to just watch the show, and definitely just interact in the comment section. So tell us what you know about STIs. Do you have any questions for Doc? Doc is here and is going to be able to respond to those questions. So as we dive right into our discussion of today, I would like to open the discussion by asking you, Doc, a UTI and an STI, we get to find that a number of people get to mix them up. So help us understand what a UTI is and what an STI is.
All right. Thank you, Margaret, for that important question. I need to say as I begin this topic, that STIs remain a major public health concern, particularly amongst the young people. And the good news is that most of these STIs are preventable as well as treatable, and they are curable as well if the diagnosis is made way earlier. Coming to your question, when it comes to the sexually transmitted disease, these are the infections that are mainly spread through sexual contact, and that can include through vagina or anal sex or oral sex. And some of these sexually transmitted diseases also, they are transmitted during childbirth, in which a child can get it from the mother during childbirth. So it's always important to know that aspect. when it comes to the aspect of UTIs now, we are saying UTI is also an abbreviation of urinary tract infection. We are looking at the infections that tend to affect any part of the urinary system. So when it comes to the urinary system now, we are saying the urethra, the bladder, as well as the kidneys. So those are some of the examples of the organs that are affected when it comes to the urinary tract infections. Thank you.
Thank you so much for that explanation, Doc. I like the fact that you have differentiated the two, and you have of course given us how exactly each is transmitted and whatnot. So now when we get to look at STIs and UTIs, you are going to find that a number of young people, they don't really know how to differentiate it, because at times they feel like when one is having some burning sensations when urinating, they get to think it's an STI, or maybe when one is experiencing an STI symptom, they might think it's a urinary infection. But then, Doc, help us understand what are some of the common symptoms that one gets to experience when they're having either an STI or a UTI.
All right, thank you. I need to say the sexually transmitted disease as well as the urinary tract infections, they tend to affect the same reproductive organs. And you might be aware to say some of the STIs that are going to affect the urinary tract, like in men, their presentations will be almost the same as that of the urinary tract infection. So it's always important to say, once you have certain symptoms of certain presentation, you might need to rush to the doctor or to any facility where there is a clinical officer that they might make a diagnosis. And it's somehow difficult at times to differentiate to say whether you're having a sexually transmitted disease or urinary tract infection, because the organs or the parts that are affected are usually the same. I'll give the example for men. So you would find to say, in case we've got a urinary tract infection that has affected the urethra, so what will happen is that the presentation might be somehow similar to that of a sexually transmitted disease. So what they are going to experience now, they're going to have a burning or pain when urinating, and others, they tend to have some sort of an increase in the frequency of urinating. So you'd find to say you're rushing to the toilet to go urinate. Just a few urine in your bladder causes irritation, and you feel relieved by urinating. Others, they tend to have lower abdominal pains, and others, they tend to have a change in the color of the urine, in which you might find to say your urine now has got a bit of blood in it, or the smell has changed. It is somehow a foul smelling. Others would eventually have some sort of fever, nausea, vomiting, and these are almost the same at times, similar presentation with that of a sexually transmitted disease. So it is imperative to say you seek some sort of medical, whenever you have got such a presentation as a patient, the area you seek them, the area it becomes for them to differentiate and to make a proper diagnosis and put you on the right treatment that you might need at that particular time. Thank you.
Thank you so much for that, Doc. Your explanation really is kind of now giving us an idea of what a urinary tract infection is and what an STI is. And I hope to everybody who is watching today, whoever is listening, I hope you are getting the right information here on this show. And if you have any contribution or any question that you'd like to ask our doc here, this is the time you can ask us and just let us know where you're watching from so that we can give you shout outs. You know, this show is not possible without you, our viewers. And of course, we want to give you the right information that you're going to use at the end of the day. So, Doc, you have mentioned a number of things, especially on how somebody can just identify if what they're experiencing or what they're having, if it's an STI or if it's a UTI, of which you've mentioned a number of things. But then this brings me to the next question, where can someone contract a UTI? Can somebody contract a UTI through sexual activities, or does it automatically become an STI?
So I need to mention, to make it mention, to say a UTI affects the same organ that the sexually transmitted disease might affect. So it is possible also to have a sexually transmitted disease affecting the urinary system. Then you are going to have a UTI. So let me take for an instance to say you have got the aspect of sexually transmitted disease that presents with a discharge. So you're going to see, to say what will happen is that, for instance, you've got gonorrhea or maybe chlamydia. So what will happen is that within your urethra, you're going to notice, to say there will be some sort of discharge that will be coming out. So initially, before that discharge, you might see, to say, first, the presentation that will come, it's like there will be some sort of itchiness or irritation within your urethra. The next, you might notice, to say, it's going to become painful. And eventually, you're going to notice, to say, there will be a discharge coming out. So it is possible to say STI can cause urinary tract infection because it affects the urinary system. So that's how it eventually now becomes a urinary tract infection. So it's possible, yes, for a UTI to be caused by a sexually transmitted disease. I need to mention, like the gonococcal that are given, and as well as the chlamydia infection. But I need also to state, to say, not all the UTIs are secondary to the sexually transmitted diseases. So there can be others, like in case of what we call the normal flores. Within your body, within the lining of your GIT system, especially in women, you will see, to say, the proximity of the anus and the vagina are so closer to each other. And there are others who are from back to front. So there is a possibility, to say, you might push some fecal matters coming into the vagina. Then you're going to have what we call ascending UTI. Now, from the fecal matter, you get an infection. And remember, to say, the urethra for a female is quite shorter compared to that of a man. So eventually now that infection is able to go into your urethra and cause a urinary tract infection. And I need to mention as well, to say, urinary tract infections are very common in females, especially young children. So you'd see, to say, most of the times they would come with fever. Others would complain of pain when urinating. The reason being of what I stated, to say, how they clean themselves as they go to the toilet. And secondly, their urethra is quite short also. So at the end of the day, it becomes easier for infection to enter through and goes and cause what we call the same infection called the urinary tract infection. Though there are other several factors as well, including the pants that we do give to our children at times. Those can have also certain attributes to having urinary tract infections.
Thank you so much for that explanation, Doc. You've mentioned a number of things, and I feel like, in as much as I am hosting this show, I'm also learning at the end of the day. So today we're talking about stay informed, stay protected, understanding the difference between an STI and the UTI. How do you mix them as a young person? How do you understand these things? Do you mix them like when you're having a burning sensation? Maybe you're having a UTI, and then you get to start thinking you are having an STI. So these are the confusions that we get to have among adolescents and young people, especially when they get to find themselves in such a situation. But today's show is here to inform you and to ensure that you stay protected as we learn from our doc here. If you have any comment, if you have any questions or any contributions towards this show, you can just uh, send it in that comment section, and we'll be able to read it out, as this today's show is a little bit special, not the same as all the shows, but this one is going to be a little bit special and a little bit short. So if you don't take this time to ask your questions or to just contribute on this show, you might miss the chance to get the response that you really need from Doc. So this is the time you can ask and interact with Doc here. So, Doc, you've mentioned a number of things, especially on the symptoms that one gets to have when they have a UTI, the symptoms that one gets to have when they have an STI, and of course how somebody can just get a UTI or an STI. But in most cases, as at now, as we speak now, we have a number of cases, like new infections that are coming up, especially amongst young people and adolescents. They're finding themselves to be amongst the people that are testing positive for these STIs. And it's so disappointing to see that we still have such numbers coming up abruptly, even after having different services that are being provided by you healthcare providers, different services that different organizations are offering, and just the governments themselves, they've gone as far as providing free condoms to young people in each health facility. Like, young people are able to access these free condoms, but then we have a number of young people who are testing positive for STIs. But then among us, the people that we have, especially the young people that are being found with STIs, many of them get to choose self-medication. Like, they get to want to self-medicate themselves whenever they experience pain. Maybe sometimes, just as I mentioned earlier, to say sometimes we get to confuse the two. You might feel like you're having an STI, but in the actual sense you're having a UTI. But then, as young people, we want to self-medicate ourselves and just experiment things and see if whatever we want to do at the end of the day is going to help us feel better and just cure us. But what are you being a doctor, kindly tell us the risks of that come with self-medication without being tested, maybe, or without really knowing or understanding what's going on.
So the risk of giving yourself medication once you start exhibiting some sort of signs or symptoms of STIs or some sort of UTIs is that you can create some sort of resistance within the medication that you're giving yourself. So what comes into play is that, one, you don't know the actual organism that is causing that UTI. And two, you might not realize, again, to say, on the market shelves, apparently, those certain drugs have become resistant to certain sexually transmitted diseases, in which, at the end of the day, you give your medication. At the end of the day, you're not going to improve. Your condition will continue worsening, and later on, you might develop some other complications, in which, if you had seek some sort of early medical treatment, you could have prevented other complications setting in. So I would get an instance like there is these some sort of sexually transmitted diseases. There are some that would present with an ulcer, maybe a small sore. There are some that would present with some sort of a discharge within the urethra. There are some which might present with some sort of growth within your genitalia. So it is quite important to say, in case you're dealing with those that presents with some sort of a discharge, you will realize for men at a certain point of their lifetime is that the urethra will close up eventually, then meaning you have other complications. In case of females, you will realize again to say, in case the STIs have been there for a long period of time, they might complicate now in future in your entire life, in which they may ascend maybe to affect your pelvis, meaning your uterus might be affected, your fallopian tubes might be affected, your ovaries can be affected as well. Then eventually you can have challenges in conceiving. So you will try by all means to get pregnant, but hence forgetting to say the UTIs that you are trying to treat yourself or to put yourself on self-medications could have complicated now into serious eventualities, which could have been prevented had you gone to seek for medical services area and had you been put on proper treatment in which that medication could have cured it completely. So my advice would be, whenever we experience any symptom relating to the sexually transmitted disease or urinary tract infection, we shouldn't trivialize these matters. We need to rush for medical checkups. They get the samples, they take to the lab and find the organism that could be causing that. Then later on, they will put you on proper medication. Because in the sum of investigation that we do, we also test the drugs that are going to work on your problem that you're having. So you will realize to say, in case we get your urine, we'll send it for them to look at it on the microscope, for them to do the culture so that we see which organism is in there. Then we do also the sensitivity test, know which drug is able to cure that organism that has grown. So it's not just for fashion that you would want to come to the clinic, then would want to test you and know what particular organism so that we give you the correct treatment. So my communication is that whenever you experience any form of discomfort on your genitalia, seek for proper medical services so that you might avoid certain complications, because it is important to know to say ignorance has got no cure, and self-medication also have got serious complication on your aspect, like I alluded, that might affect your future. Thank you, Margaret.
Thank you so much for that explanation, Doc. And of course, you have given us the consequences of what exactly that was my next question, but I'm glad that you have just spoken about it, like the consequences that one can get to experience if they don't get treated on time, and of course something that they might experience if they try to treat themselves without really knowing what exactly they are facing or what exactly they are going through. So this goes out to each and every particular person who's watching, a young person, whoever it is, a guardian or whatnot. It's very important to reach out to the health facility whenever one feels like something is wrong. Don't rush into ensuring that you start practicing self-medication. You might not know what exactly you are treating at the end of the day. So thank you so very much for that, Doc. I have seen that a number of people are watching. I have seen people commenting. We're watching from Livingstone, we're watching from Kitwe and whatnot. I have a comment here, and it's coming from Elena. And she says, Elena is my name. So my question, Doc, this is your question. So my question, as TYP, how can you help us people who have learned here the difference between STIs and UTIs to be known in our communities by our young people out there and the community at large. So let me just read that. 𝗙𝗎𝗲𝗲𝗲, how can you help us? How can you help us as people who have learned here the difference between STIs and UTIs to be known in our communities by our young people out there and the community at large? Doc, I don't know if you would like to answer this, or maybe I should respond to it as STIP.
Because it's really coming direct to you. What they want is on the aspect of the public health aspect, to say you need to bring in the aspect of sensitization of the community. And how do you do it? So these people who are watching becomes ambassadors now to their friends. Because I know to say, always a friend would come to you to complain about how they are feeling in a particular day. So through the information that you have learned today, it is important that you should be able to advise your friend to say, early testing is going to help in the detection of any infection that you might be having. Henceforth, complications might be prevented. And it is also important to mention, to say to your friends, to say, if they get treatment early, it is going to prevent some sort of long-term health problems, like I had alluded earlier to say, in case of those discharge UTIs or discharge STIs, like infertility or chronic pain at times that they might be experiencing, as well as pregnancy-related complications. So it also reduces also to transmit these sexually transmitted disease to others, because you are going to get treated. And at the end of the day, you're going to know to say, once I'm treated, I need to refer also my sexual partner for treatment, or you need also to inform your partner. So what we do in our hospital setup, we've got what we call the trace contact. So once we identify you to be having a certain sexually transmitted disease, we do advise that you come with your sexual partner, your sexual partner, so that as well is put on the medication. And what we are going to advise you also is that you need to bring in the aspect of condomizing. You need to condomize so that you prevent the leak infection yourselves. And thirdly, we are going to advise you also to say there should be the aspect of compliance to the treatment that we could have given you. You finish your treatment, you come again, we retest you until we confirm that you are truly negative. And that's when we let you go. So it is a challenge though. One might have several sexual partners, and how do you trace all of them? So I need to mention to you, my young people, to say these sexually transmitted diseases are preventable. And what are some of the ways in which you may try to prevent them? So one, you need to abstain from sexual activities or delay for you to have the sexual debut. But what we are seeing now is somehow that is different. I don't know, maybe it's due to the learning of the reproductive system which has started to occur earlier, or maybe it's just some sort of young people now have started to explore what we didn't know during our time. So you'd find to say at 13 years, somebody is already engaging in sexual activities. Also, if in case you've got a partner, you need to be faithful to one partner who is uninfected, of course. The other aspect that we talk about always is to use condoms, and condoms are supposed to be used consistently as well as correctly. So you do it to say, today I'm going to use a condom, or you're going to visit somebody. You use one condom, then the rest you continue having sex without the usage of the condom. And I need to mention to say, one of the important news that I have is that there are certain sexually transmitted diseases that you can prevent by getting a vaccine. And a good example of those are hepatitis. You've got also the human papilloma virus. There are vaccines that are available that you can get vaccinated. And once you get vaccinated, you can prevent yourself from having these sexually transmitted diseases. Like the hepatitis vaccine prevents you to acquire cervical cancer. For the hepatitis, might also prevent you from acquiring the hepatitis B virus, which is deadly, and it tends to affect your liver. And in some patients, you have seen to say the end result, we tend to have some sort of liver cancer, which is also deadly. And within a shortest period of time, you might die at your younger age. The other aspect as well, it is important to say whenever you've got some sort of signs or symptoms of a sexually transmitted disease, you need to go for regular STI screenings, provided that you are sexually active. You need to be going for regular STI screenings. The other aspect, again, it's imperative to say what we are seeing now is that a number of youths are engaging themselves in a lot of illicit drugs. So you can get hepatitis through the injection in case you are on certain drugs that requires an injection, because you tend to share that injection. So remember, HIV also is a sexually transmitted disease, which you can get from there. You can also get the hepatitis also, which is a sexually transmitted disease. Also, you need to avoid also alcohol. Alcohol and other drugs, they tend to impair our judgment and lead, of course, to some sort of leaks sexual behaviors. So when you are drunk, you've got no control of a proper usage of a condom. You might say you use the condom, but my question still comes back. Did you use it correctly? And did you use it consistently during your debuts? So, which becomes now also a difficult point that you can't answer because you're unable to recall what you had encountered the previous night. So alcohol and other drugs, they tend to impair your judgment, and eventually you're going to have a risk behavior in which you might eventually contract some sort of sexually transmitted diseases. Thank you, Margaret.
Thank you so much for that explanation, Doc. I think you have preempted everything that we needed to see. We have another comment here. This one is coming from 𝗙𝗂𝗧𝗂𝗧 𝗙𝗂𝗧𝗂𝗧 says, hello, everyone. The show. Hello, enjoying the show. My question reads, so adolescents and young people, okay, so let me read this correctly. This is a message from 𝗙𝗂𝗧𝗂𝗧, and 𝗙𝗂𝗧𝗂𝗧 has about two or more questions. And the first one is, why are adolescents and young adults particularly vulnerable to STIs? That's the first question. And then the second question is, how can parents, schools, and healthcare providers improve sexual health education among young people? And then the other question reads, what role does stigma play in preventing young people from seeking timely diagnosis and treatment? Doc, I hope you have noted those questions, or maybe I can read them one by one to you so that you can just respond to them one by one, of which the first question is, why are adolescents and young adults particularly vulnerable to STIs? That's the first question, Doc.
Okay. I'm going to start with, you are aware to say the adolescents, it's because of their behavior. I'd mentioned one point, they've got a risk sexual behavior. So you'd find to say, we do say, people, you need to wait to start sex until you're married. But we are seeing now scenarios, I don't know whether it's due to the social media. The young people, they tend to have sex at an early age. So you'd find that 12, somebody knows already they have had an encounter. The other aspect is on the having multiple sexual partners. We know the aspect of peer pressure now. When teenagers are in colleges or young people are in colleges, they see one with an iPhone. The next thing that we would want to do now is to find a sugar daddy who is going to be there to fund them. And at the end of the day, you're trying to say there is also a student that you are with in college. On top of that, there are two sugar daddies who are funding their lifestyles. The other aspect is on not knowing on how to use the protective measure, which is the condoms. You will see to say, for you to prevent certain sexually transmitted disease, you need to use the condom consistently and correctly. But there is inconsistency. And remember to say, sugar daddies come with demands. If you want an iPhone, I want sex without a condom. Hence, you are going to give in because that's what you want. And the other aspect that I'd mentioned was on the drugs. You will see to say a lot of young people now, when you go in certain areas, they indulge themselves in illicit activities like taking alcohol, they are taking certain drugs, and at the end of the day, that impairs their judgment. And they tend not to remember any encounter of their sexual activities. And of course, let's not run away of the limited knowledge. You will see to say there is limited knowledge when it comes to sexual education. And of course, there is also misinformation from peers or social media when it comes to the sexual activities. There are witch doctors who tell them to say, just latch to me, I'll give you the medicine, and you're going to be okay. Or they'll give them information to say, when you've got this, I had it also. What I did is ABCD. Then at the end of the day, they follow the long advice through the social media. And also, there is low awareness when it comes to the presentation, as well as the prevention of the sexually transmitted diseases. So these information are supposed to be there. I really thank you, STIP, for taking this stand to try to help when it comes to the aspect of advocacy. But not forgetting, let's try to also not forget about biological factors. When it comes to girls, girls are biologically more vulnerable to certain STIs. And it is because of the cervix that is developing and making it more easier for infection to enter easily. So, and it is also important to mention to say, many STIs in girls, they can come or present without any symptoms or any clinical feature. Not until during their adult onset, that's when you would see certain things coming out. And I don't know also when it comes to health-seeking behavior, a lot of girls would fear because of stigma or discrimination again, or maybe avoiding being judged because of whatever they might be having at that particular time. Or they would feel imbalanced to try to discuss about their sexual related health with others. And not really forgetting, we've got really limited access to youth-friendly services. So that comes again to that question now, how can school improve or come in helping out to reduce the sexually transmitted diseases? In Zambia, we've got limited access to youth-friendly services. So what am I looking at? If we can have a youth-friendly corner in schools that are able to talk about these sexually transmitted diseases, and if schools are able to open some sort of sick bays where they can employ qualified personnel to run those sick bays, it might help. And on that matter, I thank the Health Professional Council of Zambia through the Ministry of Health. There is a document that is called National Healthcare Standards now, especially when it comes to Chapter 2. Chapter 2 talks about sick bays. The Health Professional Council registers sick bays in which they can employ somebody who is qualified and be able to be helping those who would want information or those who've got symptoms pertaining to certain sexually transmitted disease or UTI, that they are managed or referred early in order to prevent certain complications. Let me not also forget to talk about peer pressure and social influence. Peer pressure.
So, we have a number of questions that would like you to also respond to that are coming from the comment section, and it seems like we're running out of time, so we can maybe just read some of the questions, and we see if maybe due to time we can be able to just respond to some of them. So we have another comment in the comment section from Kimberly, and Kimberly says, what are some of the ways to prevent a UTI? Doc, you can go ahead, please.
So what are some of the ways to prevent a UTI? What a good question to say. Number one, drink plenty of water. Drink a lot of water. I know most of us, we don't like taking water. But when you drink a lot of water, I'm telling you to say it helps to flush bacteria out of the urinary tract system. The more you urinate, the more you're flushing out the bacteria. So drink as plenty as you can daily. Then two, do not hold urine. When you feel like you want to urinate, please rush to the toilet. The more you hold the urine, it's like you create an environment now to incubate bacteria as well, in which there will be stasis of urine, then eventually you might have a lot of UTI. And of course, there is something that they do say, for those who are sexually active, please, immediate after sexual intercourse, urinate after sexual intercourse, because it helps to remove bacteria that could have entered through your urethra. And of course, practice good hygiene. Do not wipe from the back to front. You wipe from front to the back. Those are some of the things that I thought I would share, but there are many more others that I can talk about.
Thank you so much for that, and I hope that's clear to Kimberly. Kimberly, I hope that was clear. I have another comment here, and it says, Can UTI be acquired from a toilet, Doc?
Okay, like I had mentioned, it is possible. For females to urinate, they have to sit on a toilet fan. So in case there was somebody who had a UTI, urinated on the toilet fan, then you go and sit on that toilet fan, you are able to get a bacteria that can later on affect your urinary system, resulting into having a UTI. So it's advisable to clean the toilet fan before you sit on it. Thank you. So it's possible you can acquire them.
Thank you so much. Sure. Thank you so much, and I hope that's clear. If we have any other comments, if you have any other questions, as we can see, time as well, we just started the conversation, and it seems like people still want to know more on how exactly they can prevent either an STI or a UTI, and how best they can just identify the two. So I have another comment here, Doc, and it says, a lot of girls fail to negotiate for safer sex, therefore putting themselves of potential risk. Yeah, I think that's a contribution. Yeah, that's very important. Just as Doc mentions, to say a number of girls now are kind of associated themselves with sugar daddies, and of course, a sugar daddy cannot be in a position where you can tell what you want to them, but they'll be the ones to tell you what exactly they want from you, for you to get what you want from them. Thank you so much for that question, for that contribution. I think we have other comments, and we have another comment here which says, thank you for the response, Doc. My last 3 questions before you go. So here are the 3 questions, Doc. So what are the biggest challenges Zambia faced in controlling STIs and UTIs, and how can communities help reduce stigma? What public health intervention have been most successful in reducing STI transmission? So those are the questions that we have from our comment section, Doc. If you can be brief and just respond to them, and I know that some of them are kind of sounding a little bit similar to what we've already discussed, but you can just respond to it briefly as we conclude with our show.
So when it comes to the challenges of controlling STIs, I think this is a big public outcry. You're going to see there is less information to the public about the STIs, about the complications that the STI causes. So it is imperative to say we really need to sensitize our communities to know the types of STIs, and of course, states about the complications of the same STIs. So if we can do a lot of advocates work, I think that would help as well. And also, like I'd mentioned, we need also to have a youth-friendly corners being put in.
Okay, I think we have lost Doc. Be right back. If you still have contributions, if you still have questions, this is the time that you can leave them in the comment section as we are concluding with the show. So, Doc, we lost you. Can you hear us?
I'm getting you. Are you able to get me?
Yes, we are able to get you now. We kind of lost you at some point.
Okay, so I was saying, in case if we are able to have some sort of youth-friendly corners in our communities, and be able to sense those youth-friendly corners should be able to sensitize our youths or our community on the types of sexually transmitted diseases that are there, the symptoms, the prevention, including the treatment, early treatment, and the advantages of seeking early treatment. That would suffice. Also, it is also important that if those corners are able to provide free condoms, I know to say it's quite difficult to talk about condoms being given within the communities like you're encouraging. But despite even if you don't provide condoms, they'll still have the act of sex. So the only way out is to try to provide access, easy access to the condoms like they do in the hospitals. Like when you go, you find to say most of the corners do provide condoms. So if we can have those corners within the compounds where people can easily have free access to condoms or 24 hours access to condoms, I feel that might help to reduce on the aspect of STIs. And of course, vaccination, like I stated, to say certain STIs are preventable, like the hepatitis B and the other forms of hepatitis, including the human papillomavirus. If there are certain secondary prevention measures in which vaccines are given, like the government has been doing, and people are sensitized to why they need to receive those vaccines, it might help also to reduce also on the aspect of STIs. And it's also important to say we can create some sort of routine screening and early diagnosis. We go in the communities, we screen everyone for STIs. And those that we find to say they are having STIs, we put them, or we link them to care, and also notify their partners so that they are able also to be treated. I think using those means, we should be able to address and reduce also on the cases of the STIs within the communities also. And of course, it's important to say communities are supposed to be engaged. So when I talk about communities, I'm talking about school, I'm talking about parents, I'm talking about religion leaders. You know, it becomes a taboo. You go in church, you talk about the condoms, say, please use condoms. But this is a fact to say, one might be able to listen more better when a preacher preaches to say you can prevent sexually transmitted diseases through the usage of condoms, which is a fact, than a medical personnel when it comes in the community. Why? Because they are always those people and they trust whatever they bring out. So it is important to say that those are supposed to be communicated to and be able to be part of the whole strategies that you might want to bring across. And it is also important to integrate the services that you have for sexually transmitted disease with HIV programs. HIV is also a sexually transmitted disease, which I think to say if we incorporate family planning, maternal health, adolescent health services for comprehensive care, this in totality can work as a strategy on the reduction as well as sensitization of the community on the STIs aspect. So I think those are my remarks that I thought I would share with you. But I don't know whether we are concluding now.
Yes, it seems like we are out of time, and I don't know if we have any other questions or if we have any other comments before we close, so that maybe Doc can be just brief and give us the answers. But if we do not have any other comments or any other questions in the comment section, we can, I think, conclude. And Doc, you can give your last remarks as we about to close the show.
All right. Thanks, Margaret. I just need to state to say most of the sexually transmitted diseases are preventable and many of them are curable. So you need to try by all means to protect yourself. You need to make informed choices, meaning you need to be using protections. You need to be getting tested regularly for these sexually transmitted diseases. And you need to seek early medical care once you've got a feature or once you've got the symptoms alluding to a particular STIs. And I need to make it mention to say early diagnosis and treatment also help to prevent the transmission to others. So just to conclude that abstinence is always a key, and also having one sexual partner is always the key, because that will help you to know where you could have obtained that sexually transmitted disease, and always condomize in case you're sexually active. So thank you, Margaret. And it was a pleasure for inviting me to this show. And I'm looking forward for many other involvement in anything that has to do with the youths when it comes to health, because their health matters the most to me, as I'm their clinician,
Thank you.
always a doctor on call.
Sure.
Thank you.
Thank you so very much for that, Doc. Of course, your presence here has made it possible for us as young people to just one or two things, especially on issues that we get to be so confused about, and these are the issues of
Memory, Margaret has fallen off.
Okay, my network kind of kicked me out, but nevertheless, we are just about to close the show, and I just want to say thank you to our viewers, and your participation today has really been so interesting and so amazing. I like the fact that you were able to ask questions and able to just contribute towards the show. And thank you so much to Doc for being part of this show and just helping us understand the difference between an STI and a UTI. Of course, something that we get to mix up most of the times. But nevertheless, we are glad that what they think and the questions that they've been having for some time now, and now that we brought the show to them, they are just able to respond and just ask the questions that they need to ask. And of course, not forgetting Memory, thank you so very much for being part of this show and for just ensuring that the show is inclusive to each and every particular person who is listening out there. And to a young person, this information should not just sit with you. You being part of this show, you listening to this show, it doesn't mean that whatever you get from here, whatever you learn from here, should just be kept by yourself. All you can do is go in that community, go to that neighbor, go to that friend, and just explain to them, teach them. Information sharing is very important, and we learn every day. You can use the information that you've gained here to just ensure that the other person next to you also has gotten. See you next week for another topic, another interesting topic, and of course, we can't wait to hear from you. See you all. Bye-bye.